Well, I think all of us as clinicians have one similar thing that we're doing, even though we all have our own specialties and things that we're focusing on. But the common thread is that we all want to know where the client wants to be in 3 months, in 6 months, in a year. What do they want their life to be like? So we're not so focused on symptoms or diagnoses at that point, although they may be important to think about and work on, but that's not the main conversation. The main conversation is about what does the client want their life to look like, and that's where we start the conversation. I think that's also a very exciting way to work.
The roadmap to recovery is basically a plan for the client. When they first come in, the team is spending time getting to know them, but they're also jumping right into treatment. After the team gets to know them a little bit better, then the team gets together and they talk to each other and share their ideas, and then the primary and the client are collaborating together and writing the roadmap. And that's actually a really key piece about what we do. That's different than I think what a lot of other places do, is that we're not writing a plan for the client, we're writing the plan with the client. So that when we do present the plan, so to speak, that the client already is pretty aware of what the plan is, and they're ready to move forward with it.
So as a psychiatrist, I'm doing my own assessment of someone's psychiatric history. I'm looking at their records, I'm talking to their previous treaters and the client themselves, their family. But the other assessments that are being done, we have a neuropsychologist who we've worked with for years who does an expert assessment. All of the people on the team, expressive therapy, wellness assessments, nursing, vocational assessments, these all inform the whole team's approach to creating this roadmap. And as a psychiatrist, I have this incredibly rich amount of information that keeps changing as we get more and more data week after week that will inform the roadmap. And then beyond, the roadmap will continue to change as we continue to try to work with the person, get them to their dreams, and then learn that we need to do things a little bit differently. And so it's a living and breathing process, not just a document.
I think one of the things that we do during the assessment process is a lot of our assessments are kind of informal. We're learning about a client when we're driving them to an appointment, or we're taking a walk with them or having coffee with them. And so that's I think a really nice part of the process, is that you're getting them out into the community, getting them connected, but you're also doing the assessment in this very natural kind of way. The other thing that I would say is that a big part of the assessment is talking to families and learning about what the family thinks is going on, and what their concerns are and how they understand the problem and what they're hoping to see going forward. And collaborating with the family, I think, in the beginning is a really essential part to this work as well, and to understanding what's going on for a person. I think the support that we give families is essential to somebody getting better and to having the courage to make changes in their life. So without the families, I think we're missing a big piece of what we try to do.